Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today's Thursday, September 30th, giving you the update from Albany Med. All right, Fred, let's pop open the first graph here.
Yep.
This is New York State, people in the hospital with COVID. I think everybody can see that is completely flat for the last 6 weeks, I would think.
Yeah, long time, Dennis.
2,348. Next graph here is the capital region. I think there is some good news that we're starting to see there. It's trending down a little bit. The current number is 153. Fred, the number I think was at 166 or so
Yeah, that's
a week
right,
ago.
Dennis. About 2 weeks ago now, Dennis.
Right.
So we're moving.
And we all remember, of course, that its highest number was in the 550 range. So we'll watch that very carefully.
Yes.
It can go up, it can go down, but clearly right now it's obviously looking like it's moving down. Let's go inside the medical center. Next graph here is admissions and discharges, and I think often that one visually sort of tells its own story.
That's right.
And then the last one is the morning census. Here at the medical center, we currently have 37. People like the breakdown, so let's do it. It's 36 adults and it's 1 child. In the
Yes.
37, 23 are on the floor, 13 are in the ICU, and 7 are on ventilators. Let me pause for a second. Fred, you said this a couple weeks ago. As the numbers were starting to go up, we say first they come in we see the case positivity in the community go up.
That's right.
Take the story from there.
Right, so positive case rate goes up, then the hospitalizations go up, then the ICU use and ventilator use goes up, and then unfortunately the last thing that goes up are deaths.
To that point, we're looking at the number here over the last week. In the hospital, it appears to be flat, in fact, even coming down a little bit. But the ventilator use is going up.
That's right.
And we're going to talk about that in a second. So the last 7 days here at the medical center, 21 admissions, 22 out the door. So that's a delta of coming down by 1. Of those 21 who came into the hospital in the last week, 86 of them unvaccinated.
Yes.
Unvaccinated. But Fred, if there's one thing I want people to know today, it's this. We have 7 people currently in the hospital on ventilators with COVID. And of those,
all of them are unvaccinated.
All of them.
You know, Dennis, when you look at the numbers, both the state numbers as well as the capital region numbers, you have to make the connection to our vaccination rate, right? So New York State has one of the highest vaccination rates. The capital region has one of the highest vaccination rates. And so what are we seeing? We're seeing not the kind of peak that's going on nationally, not the kind of peak that's going in states with low vaccination rates, but sort of a slow, smoldering kind of phase right now.
And the point we're making, and because this has been in the news is, and we've talked about this, you can get the vaccine, you can have a breakthrough case. It does happen. We see that in the numbers that we talk about here on a weekly basis.
Right.
However, the people who come into the hospital who are the most sick, the people who end up on a ventilator and or often dying, are by and large the unvaccinated.
That's right,
That's what
Dennis.
we are seeing.
Yep.
Fred, we've talked about variants here. I know everyone knows about the Delta variant. For a while, we were talking about another variant that was coming out. We're always watching to see. That one was called the Mu variant.
That's right.
What is the status of the Mu variant?
So, Dennis, we get a report from Wadsworth on a weekly basis. We see our numbers that have been coded, if you will, the regions as well as the states. So we can tell which variants are rising or are declining. So the Mu variant, which was the variant that the feds were worried about, has sort of peaked and declined to the point now where there is no Mu in New York State. It's all Delta. Delta is the variant here at the medical center, capital region, as well as across the state.
Well, that's certainly good news
It is.
because predictions were that one might come and become dominant over Delta.
That's right.
That's great news that we don't see any evidence of it right now. Fred, we know recently that the FDA and then Dr. Walensky with the CDC came forward and made a recommendation about boosters. What they said is that for Pfizer,
That's right, just for Pfizer so
if you
far.
are over 65, you should get the booster. In the category of essential workers, which we all are, you may get the booster. And I think that is the language that was used. People have come up to us and said, okay, I'm an essential worker. When are we going to have a booster clinic here? So what do we say to them?
So Dennis, what we're telling people is go out in the community. There are lots of places where you can get vaccinated. We have not yet set up any vaccine clinics here for boosters. And Dennis, we're not requiring boosters for our staff. You know, the language that you just stated from the CDC, it's, you know, may get vaccinated, not should or must. So if you are in the category of greater than 65 or you're concerned because you're a healthcare worker working directly with patients and you want to get a booster, there are plenty of places outside of the medical center to do that.
JapaRegionVax.org, of course, is a great website to look for. We know local pharmacies are doing this.
That's right.
Because this isn't going to be, I have to get it at a vaccine clinic offered on campus here, you have choice as to where and when you go. Some people may get a reaction after the booster. They may get sore. They may have a low-grade fever. They may be fatigued. Probably a good idea. Maybe do it before you are not supposed to work the next day.
That's right. And so far, it appears as though the reactions that are happening with the booster are the same as after the second shot.
Second shot. So
That's
those
right.
who had a bit of a reaction might want to
Right.
take that in.
And in terms of Moderna, that's probably something that will be coming soon from the FDA, a recommendation around Moderna. Moderna actually submitted data on a half dose for their third dose. That looks very positive, so we'll probably hear in the next couple of weeks about Moderna.
Okay, because we know we have members of our workforce who got Moderna.
That's right.
And they want to know about whether or not they're going to get the booster as well.
That's right.
Still recommended if you got the Pfizer, you get the Pfizer booster.
Stick with what you have.
Moderna,
Andy.
wait for the ruling.
That's right.
Okay. Let's talk one last thing about vaccines. The age category of 5 to 11, which is the next age category that people have talked about being eligible. Any update on that?
So Pfizer has submitted their data. It looks very promising in terms of being both safe and effective in that age group. The FDA is analyzing it. Right now it looks like perhaps early November we'll have some determination on that from the FDA and the CDC. So it's in process, Dennis, but it looks very promising.
Very good. We'll speak very briefly about staffing. As everyone knows, we've talked about this in multiple different forums. The staffing crisis that's happening nationally is certainly happening on this campus as well. We've put into place many steps and operational and procedural changes to deal with that. Too many to articulate here. Perhaps you've been involved in that process, and if you have been, thank you. Fred, regional call today. It's everywhere in the area.
Dennis, it really is everywhere. You know, on that call are 10 facilities, and they're all experiencing the same issues that we're experiencing. So, and this is happening where we're also seeing sort of unprecedented demand for services.
No question. People have said, well, what's the connection to the vaccine mandate? As we've said, it will take a challenging situation and make it more challenging. The good news is when we got the final roll-up numbers today, I would say most hospitals in the region are in that 96 to 98%
That's right.
vaccinated rate, meaning that really only 2% of the workforce was impacted. We were above 98%, which was fantastic, so thank you to all of you.
So, you know, Dennis, even though that sounds great, only 2 to 3%, 4%
Right.
in some of the other institutions, but they started with such a vacancy
That's
rate
right.
that it's still creating a problem.
Oh, and that's why the staffing crisis is real and
That's
why the
right.
vaccine mandate doesn't necessarily fix things. If all those people were to get vaccinated, we would still have
That's
the
right.
crisis.
Absolutely.
So to that point, we want to put in the plug for the SIT program. It's one of the things we're doing where everybody in the workforce, if they choose to, could go through some training. I believe it's 1 hour long.
That's right.
They could get back into the hospital. They could be at the bedside. They could be assisting by doing what's called a safety sit, where they would be watching a patient to be sure that they don't come out of bed or harm themselves if they have a condition which makes them perhaps a little bit confused or disoriented. It's the type of thing where if you had 4 hours to give, you could do that. And the benefit is you would free up somebody who's doing that who could get back and do clinical work like a PCA.
That's right, Dennis.
So I know many have been interested in to those who've done it, thank you very much. Let's end on a positive note. DAISY Award.
That's right.
DAISY Award, as we all know, each month, this is a nurse who has been nominated by a family or someone who they've cared for to recognize the incredible grace in which they've cared for them.
Yes.
I'm wearing the Children's Hospital sweatshirt today because our winner comes from the pediatric ICU, which is the only one in the region.
That's right. So the winner of the DAISY Award most recently is someone, Caitlin Wood, one of the nurses in the PICU. And let me just read what was said by the parents of one of her patients. She treats her daughter as if she was her own. Caitlin has even done her hair, painted her nails, talks to her, and makes sure all her needs are met. She is steps ahead of our daughter at times. Because of Caitlin's knowledge and attention, our daughter has been healing comfortably and safely. We will be forever indebted to her for the love and care she's given our daughter. What a just a phenomenal statement.
Yeah, special.
Very
Congratulations to Caitlin.
Congratulations.
Cinnamon buns on their way.
Absolutely.
Well deserved.
We still have to
I know.
hit one of those cinnamon buns.
We do. All right, very good. That'll do it. We're rolling into the weekend. And as always, for those who are working here 24/7, we thank you for providing that care for our mission. Doors never close, and we'll be back again next week. All right, very good.
Very good.
We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.